Hello and welcome to NewMouth's podcast. I'm Sarah, and every week we'll journey together through the intricate world of dentistry. From dispelling myths to exploring the latest in oral health, we've got a packed show for everyone. Ready to dive in? Let's go! Welcome to NewMouth's podcast. Today we're diving into a topic that many of our listeners with braces might find all too familiar: swollen gums. Joining us to discuss this dental dilemma is Jake, an expert in dental and oral health care. Thanks for being here, Jake.
Thanks for having me, Sarah. I'm excited to talk about dental health, especially when it comes to braces and how they can impact our gums.
Definitely a hot topic for our brace-face listeners. So, Jake, why do braces cause swollen gums in the first place?
Well, Sarah, braces are designed to gradually align your teeth and jaws, but this process can sometimes irritate the surrounding soft tissue, including your gums. The swelling typically kicks in after the braces are installed or adjusted.
That makes sense. Aside from just the irritation, are there other dental conditions that can cause swollen gums with braces?
Absolutely. One of the most common conditions is gingivitis, which is a mild form of gum disease. The gaps created by braces can become playgrounds for bacteria if oral hygiene is neglected, and this can lead to inflammation and swollen gums.
That doesn't sound pleasant. Are there other telltale signs of gingivitis?
Yes, you might notice your gums becoming darker red, feeling tender, or even starting to recede. Bleeding during brushing or flossing and persistent bad breath are also red flags.
How about tooth movement? Does that contribute to swelling?
It does. The main goal of braces is to move your teeth, but that movement can irritate your gums. Generally, the swelling associated with tooth movement should be temporary and manageable with good oral hygiene.
What about something I've heard called gingival hyperplasia? Can you tell us about that?
Gingival hyperplasia is an overgrowth of gum tissue, and braces can sometimes trigger it, causing the gums to appear larger or even to grow over the braces. It mostly resolves after the braces are removed, but severe cases might require a dental procedure.
Hormones, I've heard, can also play a role here. Can you elaborate on that?
Right, hormonal imbalances like those experienced during puberty, pregnancy, or menopause can make your gums more prone to swelling in response to plaque buildup. So if you're going through a significant hormonal event with braces, you might see an increase in gum swelling.
And allergies, that's a less common cause, correct?
Yes, it's rare, but some people may have an allergic reaction to the materials in their braces, resulting in swollen, puffy, or itchy gums. That's when they should get in touch with their dentist post-haste.
Good to know. Now, if someone's gums do swell, what are some ways to alleviate it?
The good news is there are plenty of at-home remedies. Maintaining oral hygiene is crucial. Brush and floss diligently. A warm saltwater rinse can reduce inflammation, and over-the-counter anti-inflammatory medication can help with pain and swelling. Also, sticking to the right foods and maybe even trying natural remedies like clove oil can be beneficial.
Those are some solid tips, but what if those home remedies just don't cut it?
If symptoms persist, it's important to see your dentist. They might suggest professional treatments, such as a deep cleaning, a gingivectomy to remove excess tissue, ultrasonic treatment, or laser excision.
Prevention is better than cure, right? What are your top tips for preventing gum discomfort from braces?
Definitely. Stick to a robust oral hygiene routine. Use a soft bristled or electric toothbrush. Avoid problematic foods, and make sure to see your dentist regularly. These practices will go a long way in keeping those gums healthy and comfortable.
That's very reassuring. Any final thoughts for our listeners before we wrap up?
Just remember that while swollen gums can be a common issue with braces, keeping up with your oral hygiene and staying in touch with your dentist can significantly reduce your discomfort and keep your smile on track.
Thanks for those insights, Jake. And thank you, listeners, for tuning in. Until next time, keep smiling and keep those gums happy.
It's been a pleasure, Sarah. Keep up the great work with NewMouth's podcast and take care of those teeth and gums, everyone.
That's all for today on NewMouth's podcast. I'm Sarah, and it's been a pleasure sharing with you. Always remember, the foundation of a great day starts with a smile. Join us again next week for more enlightening discussions. Until then, keep those smiles radiant.